Carpal tunnel is unfortunately a very common problem in the upper extremity, and it happens a lot with people who work on computers and go through a lot of gripping activities at their work. And what happens is the median nerve, which forms in the neck from the nerves coming out of our spine, and it goes down the arm into the wrist, where it's surrounded by a bunch of tendons that come from our forearm. On the bottom here of the tunnel is the wrist bones, and over top is a ligament called the transverse carpal ligament. Now the median nerve, as it goes through here, gets compressed between all these different structures, and then we feel the pain in the wrist and numbness and pain in these three fingers. So I'm going to show you some exercises that you can do to reduce your symptoms, hopefully, and also just some common sense strategies to reduce your symptoms as well. The first thing that you want to do is figure out the things that cause that irritation. So maybe it's sitting at the computer and typing. So one of the things that you can do is maybe change the position of your keyboard. Typically we want the elbow to be at 90 degrees when we're sitting at the keyboard. And a lot of times you'll find that there's a lot of wrist movement maybe that you are engaging in when you're typing. So maybe you can reduce some of that wrist movement, and that can bring your symptoms down. You can also potentially figure out a way to use your mouse on the other hand. If you're left-handed, try it on your right. If you have it in both hands, try reducing that wrist movement, and then also maybe using mouse keys to scroll, like the arrow keys on the keyboard. And you can also try typing a little bit lighter. Those are some of the strategies that have worked for people, although you're going to have to figure out what works best for you, because everybody's a little bit different with this. Another thing that seems to work pretty well for reducing symptoms and reducing that aggravation to the nerve early on is wearing wrist braces. Wrist braces that hold your wrist in a neutral position. So not here, but right here. And just reducing that movement. If you wear the brace consistently at nighttime, and maybe even during the day, if you want to try going and wearing it even more, that can reduce that irritation to that nerve and bring those symptoms down so that you can tolerate more exercise, which we will talk about a little bit later. Wearing the wrist brace just for one night has not been shown to be very helpful. It needs to be worn pretty consistently. The first exercise that you can try is a stretch of some of the muscles in your neck. So remember I talked about how those nerves form in the neck, and then what they do is they go under the collarbone through what we call the thoracic outlet, and then down your arm. So the first place that we can stretch and reduce some of the irritation to that nerve, maybe even up here, is the scalenes. So what you want to do is hold on to a chair, turn your head the opposite direction. So let's say the symptoms are in my right hand and I want to start treating my right side. You're going to hold on to a chair, turn your neck the opposite direction, and then think about a quadrant, right? So if I'm doing my right side, then I want to bring my head over toward back behind me and to the left. So I'm going to go into this quadrant here and rotate my head away from this side, and you can see the stretch that I'm getting on my scalene muscles right here in my neck, where those nerves come through. And you want to hold this stretch for about 30 seconds each time. Another stretch that you can do is for a muscle called the pectoralis minor. Pectoralis minor is one of the pec muscles in your chest here, and what it does is it pulls the shoulder blade into this position. So if it gets very tight, it can actually reduce space for those nerves as they're going down the neck before the median nerve gets to the arm. It can have some trouble in this highway. So the way you're going to stretch it is put your arm up to 90 degrees on a rig or at a wall, and then you're going to hold it there. Take your right leg, bring it forward like this, and then the idea is you want to rotate your body away from your arm, so you're stretching right here. So we're lengthening here, and you want to squeeze your shoulder blade together as you're doing this stretch. And you should feel a nice stretch right in your pec. And you can hold this stretch for 1 minute. Now at this point, we're down to the wrist where the median nerve comes through. And in order to increase space in your wrist here, one of the things that you can do is stretch the muscles of the hand as well as the forearm at the same time. So what you want to do is bring your fingers together here, the ends of your fingers together, and then you want to straighten here at your knuckles, at these most forefront knuckles, and then you can hold here and do this stretch. If this is not aggravating and you want to progress it, you can press down here on your wrist bones as you're doing this stretch. So we're pressing here at the wrist, and then we're bringing the forearm through. And this may be aggravating for a lot of people, so you can ease into it, but you should feel better after these stretches and not worse. If you feel worse, it's too aggressive, maybe just go with this stretch right here, and then you can also stretch your fingers like this. But this is going to be maybe a little bit aggravating just because of the wrist movement. So just monitor your symptoms and take it as you can.